Okay, this video is called How to Use an Emergency Room. Okay, so the first thing is emergency rooms, they are actually very good at treating real emergencies. Acute myocardial infarction, a heart attack, asthma attack, motor vehicle accident, all that stuff. All right? But what you also need to know is they're not that good at treating chronic disease. Okay, chronic disease, mostly dietary. Fix your diet, okay? Study nutrition. The other thing about ER is you don't want to go to ER for routine problems because they'll overcharge you by thousands of dollars, so that's not good. And then probably the most important thing you can know about an ER is you want to go as early as possible in the morning. In the morning, an emergency room is like a ghost town. You can be seen first patient. There'll be 2 doctors lined up waiting to see you. Okay, if you come in the afternoon, you could have a 30-minute problem. I just sprained my ankle. All I need is an x-ray. That might take you 4 hours or 5 hours, okay? And here's the reason why. First of all, it's human nature. Most people, they wake up, they do a little something around the house, and they go, well, I probably should go to the emergency room. This problem is not going away. And they go to the emergency room in the, right around noontime, late morning, early afternoon, right when it's getting really busy, and it just keeps on getting busy through the evening day. A lot of people go to the emergency room when they get done with work, or they leave work a little early, but they worked half a day or more than half a day. So emergency rooms start filling up in the afternoon. The other thing is it's a natural course of a hospital. The junior resident makes rounds at 8 o'clock, 9 o'clock in the morning. They go, well, gee, I think there's a problem. They notify the senior resident. Senior resident checks on the patient at 11 o'clock in the morning, goes, yeah, I think you're right, there is a problem. Well, let's run it by the attending physician. Well, he's coming in at 1 o'clock. Attending physician comes in at 1 o'clock and he's like, yeah, this is a problem. Send the patient to the emergency room. So all these patients start percolating towards the emergency room. And you get an emergency room after 2 o'clock in the afternoon, it's quite routine. They're like Grand Central Station, okay? And there's going to be a radiologist on call, okay? And they're going to have a backlog of a stack of CAT scans, a stack of MRIs, plain films, ultrasounds, everything else. So the same problem you could have been seen in and out in 30 minutes for in the morning could take you 4, 5, 6 hours in the afternoon. All right, well, that's pretty much the most important thing to know. If you got a sprained ankle, go directly to the orthopod's office, all right? That would be the better way to handle that. But anyways, that's pretty much the scoop on emergency rooms.